Hello and welcome to NURS313 Nursing Informatics. I'm Dr. Mangubat, one of your instructors for this course. I want to take some time to explain the course and its requirements. This course combines knowledge and skills from nursing science, computer science, and information science in the practice of nursing. The major topics focus on informatics concepts and communications that are most critical to therapeutic nursing interventions. The course assignments will familiarize you with both the theoretical concepts and the practical application of the scholarship of nursing informatics in healthcare management and/or health services delivery. Textbook. Your required textbook is Mechanical and Maestrian, Nursing Informatics and the Foundation of Knowledge, 4th edition. The information you will find all in your syllabus. With regards to your activities, this is a course outline and the schedule week by week. I will briefly give you a little bit of an information of what you're going to do. For week 1, there are 2 activities here. First is your introduction. This is not graded, however, you are mandated to at least give your introduction. You will be asked to post your short bio and a picture of you with your favorite type of technology. The main activity here is for week 1. You will be asked to choose a clinical scenario from your recent experience and analyze it using the Foundation of Knowledge model. So the main posting will be every Thursday, and your responses to your classmates will be due by Sunday. Okay. Now, for week 2, from knowledge to cognitive science, that is when you're going to examine artificial intelligence and its relationship to cognitive science and computer science. And then you will be asked to share how you envision artificial intelligence to be utilized to improve nursing care in the future. For week 3, perspectives on nursing informatics. How is electronic health records, or EHR, being utilized in your clinical practice? Can you provide an example of how you can use data from the EHR to solve an existing clinical problem? So you can post all the answers to these questions in week 3. For week 4, wearable technology. This is when you have to post a draft of your assignment number 1, which is emerging wearable technology presentation. You need to prepare and post a well-developed first draft of your presentation for peer feedback. The initial post is by Thursday, and the feedback to your peers will be by Sunday. The final presentation for this assignment will be due next Sunday, which is week 5. For week 5, ethical and legal issues. This is when we're going to examine what are the different legalities, ethical and legal issues regarding the use of technology in healthcare. So we will also expand the use of HIPAA and HITECH Act to help to curb this problem. And that is week 5. For weeks, and don't forget, this is when for week 5, you have to post your final assignment 1 presentation. Next would be week 7. For week 7, nursing informatics administrative applications, the pre-care and care. You will be asked to read assigned chapters, then find a journal article, not from a book or a website. So you need to explore the library and look for a journal that is related to the assigned topic. You will be asked to attach a PDF copy of the article. You have to discuss the technology presented in the article and how it improved the patient outcome. Right, this is when you will be alerted on week 7 to start working your assignment number 2 presentation. Okay, for week 8, consumers and the community connection. You will be asked to read the article and watch a video and then write a reflection on those. So the way you will be assigned will be based on the last name, the beginning letter of your last names. Now, you will be alerted again to continue working in your assignment number 2. Okay, for week 9, that is when you have a break. Okay, break, there are no assigned activities in there. For week 10, workflow and beyond meaningful use, you will be asked to describe the benefits of shifting from meaningful use to the merit-based incentive payment system. What do you perceive as the obstacles to redesigning workflow within your clinical setting? What policies and procedures are in place to combat workflow challenges? And discuss electronic exchange of health information and how it may improve quality of care. Okay, in this, the assignment number 2 is due on this day. For week 11, Nursing Informatics Practice Application, Care Delivery, you will be asked to describe the implications of the EHR in regard to meaningful use and the characteristics of a culture of safety. You identify a workaround that you have used or that a colleague has used and analyze why this risk-taking behavior does not conform to a safety culture. And there's an alert here for week 12, which is next week. You will be asked to post your reflection based on a chat by you and your classmate using a chat app. It could be a WhatsApp, Hangout, Google Hangouts, Facebook Messenger, Tango Video Chat, or Skype. During this chat, there will be listed there are activities that you have to do. And then, of course, for week 12, that is when you have to post your reflections on this chat. All right, so that's week 11. For week 12, telehealth and caring in a technology-laden environment. Now, remember I mentioned about the chat. So during the chat with your classmate, 30 to 60 minutes chat, do they have to discuss scope of practice related to telehealth? Next, you have to role play by teaching each other how to take a radial pulse and then reflect with each other on your personal health. Now, for all this, you have to post your discussion on a Thursday for that week. Each student will need to identify who they video chatted with, the app they chose, and describe the interaction. All right, and there's an alert here for assignment number 3, first draft for peer review due on week 14, and the final draft due on by the end of week 15. So there is a continuous alert every week to tell you about the incoming due dates for the assignment. Next is week 13, which is research with informatics. The questions here: how does information literacy affect nursing informatics in the 21st century? You will be asked to provide a detailed description of how nursing informatics facilitates both qualitative and quantitative research and reflect on copyright law and why it is needed. And also the study of genomics with regards to the help the clinicians had gotten and to understand better the interaction between the genes and the environment. There is an alert here, start working on assignment number 3. So that's for week 13. Week 14, simulations, gaming, and emerging technologies. So this is when your assignment number 3, the draft, will be posted. It's due by that Thursday of that week, and to review the feedback so that you can post your final assignment number 3 on the next week, which is week 15. Week 15, the course reflections, you will be asked to post your reflections about on this class, how your practice is going to be different now and in the future because of the principles you have learned. You will be asked to give a concrete example without violating HIPAA that demonstrates your practice before and after the change. And you need to comment on one video you watch about a career in nursing informatics. What worked for you in this course and what did not, about what you might change if you could and what you would keep. The peer replies here are optional. So that means you don't need to post your reply to your peers. Now, don't forget to post your final assignment number 3, all right, in the assignment section. Okay, now for the grading. So all your weekly activities, which are your answers, you're posted the discussion board and also your answers or your replies to your peers post, that's 40%. Your assignment number 1, the emerging wearable technology presentation, is 20%. Assignment number 2, fake health news, is 20%. And assignment number 3, 20%, technology and nursing education presentation, for a total of 100%. The discussion board questions, that's what I explained week by week. The expectation is your responses should use proper grammar and spelling, research and reference using APA format, follow guidelines in grading rubric. Initial posts, as I mentioned, due every Thursdays. Peer responses, at least due every Sundays. The initial post, there's a minimum of 150 to 300 words in length, APA format again, and for citations and references, and should be substantive. This definition and the explanation of being substantive for the post you will find in your syllabus. For your written assignments, again, assignment number 1, PowerPoint presentation of wearable technology. Assignment number 2, detection of fake health news presentation. And assignment number 3, technology and nursing education presentation. There is a specific link wherein you have to post your final assignment. And the assignments we submitted using the Safe Assign. There is a grading rubric and details for each writing assignments, which can be found in the syllabus. For the academic integrity, academic dishonesty is unacceptable and will not be tolerated. The CUNY SPS Nursing Program considers academic integrity an essential value, and all incidents will be investigated with appropriate consequences applied. Potential consequences for academic integrity violations will follow CUNY academic integrity procedures and may include suspension, notation on one's records, program dismissal, and notification to the New York State Office of Professions. For details, you can always refer to the CUNY SPS Nursing Program policies and student handbook. Safe Assign, as I mentioned earlier, all your assignments should be submitted through the Safe Assign, because all writing assignments, there is a designated assignment link and to be screened using the Safe Assign. Safe Assign is a program that checks for plagiarism by comparing student papers to electronic databases. If your match or originality score is greater than 35, it means a significant portion of your paper or your presentation matches another paper in the database. So you need to review your matches and be sure that all writing that was taken from an article is properly referenced before you submit your final version. When you submit it, and you will see your Safe Assign score. So right there and then, you can easily check your score and see if it's greater than 35, then there is something not right, or should be, you can probably do some recheck about your assignment. Okay. Now, you should also review the policy on academic integrity listed at the end of the syllabus. For due dates and late assignments, the initial post, I mentioned many times, Thursdays, peer responses due every Sundays, all due at 11:59 p.m. Eastern Standard Time. With the lateness policy, late submissions may lose up to 10% for each day, and late discussions will not be accepted. However, if there is a problem with regards to this, the lateness, you will be late for whatever reason, and you find you might have a trouble, you can always make sure you can always refer or talk to your instructor and see what we can help or how we can help you with. Make sure that you are proactive in informing your specific instructor when difficulties arise during the semester so that we can help you find a solution. Okay? And don't hesitate to reach out and ask questions for any clarification you might need. Your instructors, we are all the instructors at CUNY SPS Nursing Program, we are all very willing to help you and available to, so please reach out. And we look forward to a wonderful and fruitful semester with you. Thank you very much.